Today we'll be talking about abnormal uterine bleeding. Abnormal uterine bleeding affects about 14 to 20% of women in their reproductive age. It affects their quality of life, it affects them emotionally, psychologically, socially, and even economically. Heavy menstrual bleeding is one of the commonest presentations of abnormal uterine bleeding, and sometimes those women even present in shock. There are some terminologies that we use to describe different categories of abnormal uterine bleeding, and these include menorrhagia. Menorrhagia is said to occur when someone sees her period more than 7 days, or that period is so heavy that is about or more than 18 mils. Some women may not be able to calculate the volume in terms of the mils. However, you see a woman that is having menses and she's telling you that she uses one full pad in a day. At least you can use your senses to know that that woman is having what we call menorrhagia, or we call it heavy menstrual bleeding. It can also be called hypomenorrhoea. It's seen in cases like submucous uterine fibroid. For a woman that is having submucous uterine fibroid, that means fibroid in the uterus, she may have these symptoms of menorrhagia, heavy menstrual bleeding. Her bleeding may last for more than 7 days, or her bleeding may be more than 8 mils, or you see the woman changing more than one full pad in a day. And sometimes they come with signs that the person is lacking blood. So these are the signs or how to know menorrhagia. Another one is metrorrhagia. Metrorrhagia is also heavy menstrual bleeding, but the difference is that in menorrhagia it is cyclical. It happens in all the cycles every time the woman sees her period. While in metrorrhagia is the heavy menstrual bleeding, but it's not cyclical. That's just the only difference. Now we have what we call oligomenorrhea. Oligomenorrhea means that this woman is having long menstrual period more than 35 days. So more than 35 days, it calculates from one cycle length to the other. It is more than 35 days. We know it as oligomenorrhea. This one happens in cases of polycystic ovarian disease or anovulation. What happens is that the uterus grows without any thing that is causing it to menstruate, like ovulation, just grows, and when it's tired of growing, it sheds. So that is why their period lasts longer than 35 days. Then others include hypomenorrhea. Hypomenorrhea means scanty menses, less than or any duration less than 2 days. So you see a woman, she says she just spotted on that day, or she just used one pad for the 2 days. It's scanty menses. That is hypomenorrhea. Hypomenorrhea can occur in cases of what we call uterine synechia, when the person has had things that cause the uterus, maybe surgeries in the uterus that cause the uterus to match together. With uterine synechia, there is adhesion, so the menses will just occur in different parts of the uterus and not the whole uterus being shed. So others include dysfunctional uterine bleeding. Dysfunctional uterine bleeding, remember we are discussing abnormal uterine bleeding. When we say that this woman has dysfunctional uterine bleeding, it means that we have looked for organic cause to that bleeding and we did not see. We now tell that the woman is having dysfunctional uterine bleeding. So dysfunctional uterine bleeding is any uterine bleeding that you cannot find a cause to it. Abnormal uterine bleeding is defined as any change in the normal menstrual cycle. So for someone that has a normal menstrual cycle before and suddenly the volume increases, the person now menstruates instead of 3 to 4 days and is menstruating more than 7 days, is classified as an abnormal uterine bleeding. For someone that the volume is, she can use one whole pack of sanitary towel to clean up all through her menstrual period, and she's not using one full pack in a day, is also classified as abnormal uterine bleeding. Or for someone that has frequency has increased, you're seeing it up to 2-3 times in a month, less than 21 days per each cycle, it has been classified as an abnormal uterine bleeding. So these are classifications because they are different from the normal menstrual cycle. The causes of abnormal uterine bleeding are divided into both structural causes and non-structural causes. Structural causes means things that we can see and feel, while non-structural causes are abnormalities, maybe in the vessels, in the blood, and things that we cannot classify. So abnormal uterine bleeding from structural causes include polyp. When someone has polyp, is a tumor, soft tissue tumor that has overgrown in the uterus and detached itself from the uterus. So if someone has a polyp, you can feel the polyp different from her uterus. It has a stalk. So when there is polyp, the person inside the endometrium, where the baby lies, the person may be bleeding abnormally. That is one of the causes. The second cause is what we call adenomyosis. Adenomyosis or uterine fibroid or malignancies. When there is tumor in the body of the uterus, it may increase the size. When there is, for example, uterine fibroid, it can cause abnormal vaginal bleeding. That is abnormal uterine bleeding. Adenomyosis, when the muscles of the uterus changes, it changes, become fibrous with muscles interchange with it. So it can lead to excessive bleeding, and that is different from the normal menstrual bleeding. When there is malignancy, for example, endometrial cancer, when there is cancer of the uterus, it can lead to abnormal bleeding. That bleeding is different from the normal menstrual cycle. That is abnormal uterine bleeding. Non-structural causes of abnormal uterine bleeding include coagulopathy. For someone that has abnormality in coagulating her blood, the normal thing is that when someone bleeds, as the person is bleeding, the body should be able to form clots to stop the bleeding. For someone that has from birth, from childhood, cannot clot blood, the person may come with abnormal uterine bleeding when the person grows. Sometimes this condition coexists with other conditions that are structural, like uterine fibroid. So when the person has coagulopathy, diseases of the coagulation pathway, the person may present with abnormal uterine bleeding. You notice this persons because from when they are still small, they bleed from their nose. We call it epistaxis. It's small thing, they bleed, small wound, they bleed, and their bleeding takes time to stop. Such person is prone to abnormal uterine bleeding and may have the condition of coagulopathy, the difficulty in trying to coagulate her blood. Then another non-structural cause of abnormal uterine bleeding is ovulatory dysfunction. In ovulatory dysfunction, especially for those that don't ovulate, what happens is that because they don't ovulate, the hormonal pathway that leads to menses does not occur. The person just, the body reacts to overgrowth of estrogen. So when the estrogen overgrows, the body, the endometrium has overgrown its blood supply, and it will just shed. The person will just shed. So, and the shedding may be more because the number of the, in fact, most times their menstrual cycle is longer, greater than 35. They have what we call oligomenorrhea. You see this in cases of hypothyroidism. You see this in cases of hyperprolactinemia. Those that have breast milk coming out from their breast, even when they are not breastfeeding, they can have a normal uterine bleeding. You see this in polycystic ovarian disorders. These patients, they have a polycystic ovarian disorder. They don't ovulate. The body will just react, the endometrium, that is the womb, will just react to overgrow, to continue to grow with estrogen, and when it overgrows this blood supply, it sheds. These are causes of abnormal uterine bleeding. What does include iatrogenic causes? Iatrogenic causes means something you introduce to yourself. For example, people on hormonal contraceptive, the body may just start bleeding, just unscheduled bleeding, and the person will stop. People that have been on hormonal contraceptive will testify to that. All of a sudden, the body, they will just start bleeding. So it's abnormal from their normal menses. People that are on intrauterine contraceptive devices, you have the form of contraception where they put it inside their womb. The person may just start bleeding unscheduled. People on hormonal therapy for one condition or the other can just start bleeding. These are the iatrogenic causes of abnormal uterine bleeding. Abnormal uterine bleeding, when found, if someone comes with abnormal uterine bleeding, there are a lot of things that can be done. Work up for laboratory workup will be done to find out what we think. We'll do both blood tests, we'll do both radiological tests, we note other things to find out. We want to pinpoint the cause of that abnormal uterine bleeding, and when the cause is found, the next thing we do is to treat the person. If it's a polyp, we'll resect it. You see, you're seeing something, we'll resect it. If it's adenomyosis, we can remove the whole uterus. If it's endometrial cancer, we'll remove the whole uterus. We call it hysterectomy. If it is uterine fibroid, you can go and do myomectomy, just remove the fibroid. If it's ovulatory dysfunction, the person is not ovulating, you try to treat that condition. If the person is having breast milk discharge, we'll give the person drug to stop it, and the person's body comes back to normal, and she will have her normal menses. If the person is having polycystic ovarian disease, we'll treat such. In cases of ovulation, we'll just take over the ovulation and allow the person to ovulate, and things normalize this. If it's coagulopathy, anything that is found, it is treated according to the cause. So the thing is that noting that your menses is not normal, that is different from what is supposed to be the normal, either in the duration, either in the quantity, that is the volume. or either in the frequency, how frequent is it? Are you seeing it less than 21 day cycle? Is really abnormal. Or are you seeing it after 35 day cycle? Is abnormal. So whatever if you found out that you have an abnormal uterine bleeding and you seek medical attention, whatever it is will be sorted out and the person lives her normal life and quality of life improves. So thank you for watching to this point. If you have not subscribed, please subscribe. My name is Dr. Nkiruka Bridget at OBGYN Talks with Dr. Adazion. I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes men's health on my channel. Thank you. Follow for more. See you next time.